So for the midpoint, I would like to do you a favor. You ready to play? So inside, I started at a summer camp when I was 9 years old. Anyone been to summer camp? Sleepaway camp? 2 months a year, my parents would put me on a plane from LA to New York. Came back one summer, I had a sister. That was kind of interesting. And then I went there, and by the time I was 15, I was like, this is really cool. I could get a job here. And so I was a counselor at that camp from 15 to 21. And at 21, I was a waterfront director. It was really cool, and it was a great experience. And fast forward, about 8 years ago, before I started my job at 201, I decided that I was going to take a sabbatical. And the day after I took a sabbatical, I got a call from the camp saying they were looking for a summer camp director. So I got to go back to the camp. I went as a kid, brought my kids along, and got to run the camp. And during that experience of reliving my childhood a little bit and thinking how cool, it was always my dream to come back as a director, and it actually came true. But would it be that good? And when I was there, being out of school for a while and being in different roles in different companies, I got reconnected with what it was like to be myself at 15 through 21, and looked at leadership in a different way and realized that kids didn't listen the same way that I did when I was younger, because I didn't want to get in trouble. They don't really care. A lot of the kids I dealt with. But I kind of fast forward, and right now I'm working on a book called Everything I Learned About Leadership, I Learned at Summer Camp. Because some of the things that we've been able to do at our organization and some of the things that we do in the community kind of take that free-flowing spirit of, you got to make it up as you go along, right? What do you do when you have a full day of activities and it starts raining in upstate New York, and you've got 29-year-old kids looking at you? You got to make it up. So what do you do in your company when you come in and you find out that the technology you bought wasn't really the technology you needed? Or that someone who had been there for 5 years now is leaving and going off to another, right? We kind of have to make things up as leaders. So I want to give something to you right now. If you could you can be on your phones during my talk, but the first 5 minutes, if you can actually put your phone away for a minute or just put it on the table, I want you to spend 5 minutes and watch one of my favorite speakers. I'm one of the co-organizers for TEDx San Diego, and so Simon Sinek's one of my favorites. Who's seen Simon Sinek's talk? Great. The rest of you are going to enjoy it. It's only about 5 minutes of his 15-minute talk, but you can watch the rest online. And I just want you to think about you and your journey.
How do you explain when things don't go as we assume? Or better, how do you explain when others are able to achieve things that seem to defy all of the assumptions? For example, why is Apple so innovative? Year after year after year after year, they're more innovative than all their competition. And yet, they're just a computer company. They're just like everyone else. They have the same access to the same talent, the same agencies, the same consultants, the same media. Then why is it that they seem to have something different? Why is it that Martin Luther King led the civil rights movement? He wasn't the only man who suffered in a pre-civil rights America, and he certainly wasn't the only great orator of the day. Why him? And why is it that the Wright brothers were able to figure out controlled powered manned flight when there were certainly other teams who were better qualified, better funded, and they didn't achieve powered manned flight, and the Wright brothers beat them to it? There's something else at play here. About 3.5 years ago, I made a discovery, and this discovery profoundly changed my view on how I thought the world worked, and it even profoundly changed the way in which I operate in it. As it turns out, there's a pattern. As it turns out, all the great and inspiring leaders and organizations in the world, whether it's Apple or Martin Luther King or the Wright brothers, they all think, act, and communicate the exact same way, and it's the complete opposite to everyone else. All I did was codify it. And it's probably the world's simplest idea. I call it the golden circle. Why, how, what? This little idea explains why some organizations and some leaders are able to inspire where others aren't. Let me define the terms really quickly. Every single person, every single organization on the planet knows what they do 100%. Some know how they do it, whether you call it your differentiating value proposition or your proprietary process or your USP. But very, very few people or organizations know why they do what they do. And by why, I don't mean to make a profit. That's a result. It's always a result. By why, I mean what's your purpose? What's your cause? What's your belief? Why does your organization exist? Why do you get out of bed in the morning? And why should anyone care? Well, as a result, the way we think, the way we act, the way we communicate is from the outside in. It's obvious. We go from the clearest thing to the fuzziest thing. But the inspired leaders and the inspired organizations, regardless of their size, regardless of their industry, all think, act, and communicate from the inside out. Let me give you an example. I use Apple because they're easy to understand and everybody gets it. If Apple were like everyone else, a marketing message from them might sound like this. We make great computers. They're beautifully designed, simple to use, and user-friendly. Want to buy one? Meh. And that's how most of us communicate. That's how most marketing is done, that's how most sales is done, and that's how most of us communicate interpersonally. We say what we do, we say how we're different or how we better, and we expect some sort of behavior, a purchase, a vote, something like that. Here's our new law firm. We have the best lawyers with the biggest clients. We have, we always perform for our clients, do business with us. Here's our new car. It gets great gas mileage. It has, leather seats. Buy our car. But it's uninspiring. Here's how Apple actually communicates. Everything we do, we believe in challenging the status quo. We believe in thinking differently. The way we challenge the status quo is by making our products beautifully designed, simple to use, and user-friendly. We just happen to make great computers. Want to buy one? Totally different, right? You're ready to buy a computer from me. All I did was reverse the order of the information. What it proves to us is that people don't buy what you do, people buy why you do it. People don't buy what you do, they buy why you do it.
Okay, I'm going to let you watch the rest on your own. Raise your hand if you had seen it before, just a few. Do you guys like hearing it again? Kind of hits you a little differently. I use it in a lot of talks, and every time I listen to it, I get a different charge. So what I'd like you to do is take 2 minutes. Actually, I'm going to give you 3 minutes. What I want you to do is take a piece of paper, I want you to take a pen, and think about when you woke up in the morning, there was something that drives each and every one of us in the job that we do. I think we're fortunate because I talk to a lot of for-profit companies that are out there, and they may have like a different drive. I know there's a lot of people here who have a real, even whether you're for-profit, non-profit, government, people in this room, you can feel the social purpose. So it might be even easier for you. But write your why, right? Why you do what you do. Go ahead. Okay, who's out there that heard a why statement that said, wow, that's a good one? Okay, come on up here. I want the first 5 people that get up here get to share their whys. Go. Come on, campers. Now they got all shy. I saw some hands. I saw a hand back there. Oh, now there's finger pointing going on. Now we have pushing. Get up there. Right there in the back. Come on up. It doesn't matter. If you wrote it and you want to say it, or you heard it and you want to say it, come on up. I only need 5 people.
I'm 1, 2. All right, come on, Larry.
I heard the reception starts at 4:45, whether or not we're out of here, so come on. Okay, go for it.
I heard someone wants to change the Health and Human Services and other people who want to change and improve lives, and I thought that was a huge undertaking. I gave him the pat on the back and said, good luck. No, I said, we're here for you.
What I heard was because everybody deserves to be awesome.
Nice. We need 2 more people, by the way. This is important.
So Erica Martin thought this was nice. To fight the corporate evil that makes us all eat, smoke, consume stuff that makes us unhealthy, unhappy, and feel unloved, so as to make people, communities, and populations more happy and healthy.
Love it. That deserves a hand, right? All right. Should I call on Daniel and see what his why is?
I said it. That was it.
Oh. Love it. Okay, didn't work out for my call out. All right. Thank you for playing. Okay, so what I want you to do is there's a Twitter handle for this conference. Raise your hand if you're on Twitter. I would love it, and I think we would all love it, if you tweeted your why. And hashtag, anyone know it? Hashtag HHS DataFest. All right, you can do that. I know you're going to be on your phones anyway. It's totally cool with me now. Thank you. Good job. All right. I have ADD. I know how it works. It's all good. So I am really excited. On a serious note, I'm really excited because 4 years ago we showed, is this mic working okay? Okay, thanks. 4 years ago we sat down with our team. I started with 2-on-1 about 8.5 years ago now. We've had an incredible journey. It's definitely been a journey going from about 10 staff. We now are about 150 staff. At that time, we had hit about the 100 mark. And I saw this talk, and I sat down with my executive team, and I said, I just want you to watch it. Tell me what you think. And earlier on, I had been bringing on some board members and some people in to listen to the calls that were happening at 2-on-1. And I said, and they all would be really nice. They'd get out of the room, and they'd say, oh, that's great. It's a great service you guys provide. And I said, really? How could it be better? And so 4 years ago, it's interesting how things progress. We're at a point now where we're making some real changes, and we can't do it alone. And really what took over the last 4 years was, is there an appetite in the community? Is there collaborative spirit in the community where we could actually live out what vision I was hearing from people that we were working with? And so raise your hand if you've never heard of 2-on-1 before. Okay, that's a first for me. In San Diego, only 1 in 3 San Diegans know about us, so I never hear about it. So currently in San Diego, we're handling about 500,000 contacts a year. 60% of those clients are repeat callers. So we keep saying we can do better. We've done some projects. It's great to have my colleague here, Dale Fleming from the County of San Diego, who believed many years ago, probably 8, 9 years ago, when not a lot of people believed, that 2-on-1 could have value and we could find some partnerships, and started an enrollment department where we help enroll clients in Medi-Cal and CalFresh, utility assistance, other programs now covered California. We wanted to be less of an information referral, giving out phone numbers, and really see how could we help someone beyond that. We then figured out that by looking at our data that about 20% of our callers, health was their #1 issue. Maybe they got enrolled in Medi-Cal, CalFresh, but they've never had health insurance before, and they needed someone to help them understand it, encourage them to use their benefits, deal with transportation and prescription drug assistance. We have one of the largest returning military in San Diego. And fortunately, our county was fortunate to receive funding from MHSA service dollars to create a peer-to-peer hotline. So we hire military spouses and post-9/11 vets to man the phones so that when someone calls into 2-on-1 and they're identified as a vet or a military spouse, that they can get connected to a peer and have a conversation. These are deeper conversations, obviously, than a 2-on-1 call. But even on a 2-on-1 call, it's anywhere from 7 to 10 minutes of understanding the person's situation. And we obviously deal with a lot of disaster relief. So we were called into the fires in 2007, 2014, other incidents in between, H1N1. And 2-on-1s, not only 2-on-1 San Diego, but 2-on-1s around the country have been called in to play this role. Each one of these instances, whether it's a disaster call that lasts a minute or a call that lasts 7 or an enrollment, think of the amount of data that's communicated. I was thinking of Watson earlier, thinking, wow, what if Watson could listen to every single 2-on-1 phone call and build up a knowledge engine of all the different things that people are looking for and how to get that delivery out to the community. So when you think of San Diego, what do you think of? Did you guys lose all your energy already? I'm trying. The ocean, what else? The zoo, hey, the zoo's up there too. What else? Okay, that's all the pictures I have. But what you might not think about, right? It's a beach town. But what you might not think about is how complex a county like San Diego can be. We're the size of Connecticut. We're the 5th largest county in the country. I'm going to just read some of these because I don't know if in the back you can see it, but 18 different cities. We have 18 tribal nations, 100 different languages. We have the world's busiest border, coastal, rural. Dale's got her hands full, right, Dale? Yeah. And so how do you attempt any kind of project? How do you attempt to get something done as an organization, even a small organization like ourselves? I think Simon Sinek talked about it, is what's the common why? And fortunately, we have a collaborative and very inspiring county government. And it really came upon, and how many of you have heard about Live Well San Diego? All right, great. It became our beacon. 5 years ago, 211 looked at this and said, you know what, in that building better health is building a better service delivery system. We now have our anchor. We now have something that we can tie to, that we can aspire to. The County of San Diego looked at what was facing the community. 3 behaviors resulting in 4 diseases that were causing more than 50% of the deaths. It's probably not much different in other areas, but how inspiring to know that we could actually accomplish something. We could actually work towards something. So then we talk about the way that we're measuring it, the way that what's on their mind when we think about what does the outcome look like, what are we searching for, what does our data need to align for. And so to do this right, which is part of my talk today, is how do we get from here to there? How do we accomplish something as wide span as Live Well San Diego, getting everyone on board from the health community to government, both city and county, to nonprofits? It comes down to not only technology, but we need to have the right technology in place. So they're on a very ambitious movement right now to create a person-centered approach, right? We have many businesses. I always equate it to my bank when I talk to my staff. Everything is person-centric right now. As you as a consumer, you want that. They're moving towards that. It's ambitious, but it's so important, and it's so critical, and they see it as their hope. And when we look at 211 and the amount of referrals that we give to county-based programs, to know that there's a person-centered approach there, the incredible result is just very exciting to think about. At the same time, you know, everyone's going to this. Everyone's going to person-centered, including our healthcare. We have a beacon community that's now turned into San Diego Health Connect. They're connecting the entire health spectrum. So from your doctors to your hospitals to your labs. 3.1 million people are currently part of the exchange in a community of 3.2 million, not too bad. And the goal is to have a federated model. It's in place now. It's exchanging information every day. And with clients' permission, I went into Sharp the other day and I had to consent to be part of San Diego Health Connect, to share my record. So we have a phenomenon going on. And then there's 211. You know, again, we're an information referral business. But we need to move to person-centered. When 60% of your clients are repeats, we don't want to start the conversation over every time. All you have to do is listen to one upset caller and trace back their phone number and listen to all the calls coming in. We're creating that sometimes. And so what about an ecosystem where when 211 makes a referral and collects that information, and the client gives us permission to share it with the community-based organization that they're being referred to, so they don't have to start the conversation there. And they can do a closed-loop referral at the agency level so that we'll know, was the client served or not? I see some nodding. So I don't know if that's being done elsewhere, but for us, it's brand new. And the second part is that then those agencies can also talk among themselves. Maybe they set up an alerting system that agency A gets triggered or an alert when a client that's in their system shows up at agency B. Just communication. Maybe 211 gets an alert because an ER discharger has discharged someone who actually needs services that we can help provide them. So we recently re-merged because we had a separation. And so I don't know if you call it an acquisition or a merger. I'll call it a merger with the Community Information Exchange, which is a project that was spawned to create the technology to allow that interaction to happen among agencies and between providers. And just in the first year, I have it written here because I didn't remember exactly the numbers. Just in the first year of coordinating social services with only a client base, there's only 5,000 people in the exchange at this point and during the pilot. They had a 26% reduction in EMS trips for those clients when they were looked up in the system. We had a 38% decrease in clients who would have exited housing during that period and back on the street, and a 44% improvement to keep people in their homes. Just with a basic triggering, just with basic feedback loops, and that's just the beginning. We have a series of about 10 steps of integration we're working on, and that's just phase 1. So to be able to do this on the social service side, and then to be able to have such a collaborative spirit with our county partner and with our healthcare,
we're creating what's called a regional information exchange. So we sit at a leadership level and say, where are the value propositions of sharing information between the social services, county services, and health services? Where's the value? Where's the greatest need? Where can we make the most impact? And if you look at it, it looks beautiful, but we know it's going to take a lot of work to get there. I think the greatest part that happens is what the conversations that happen around the table of truly being collaborative and seeing that we can do it if we work together. And there's some instant benefits, obviously, lowering cost, increasing value, care coordination. I always come back to just the person. Think of that person that might go to a community-based organization today versus in the future and what that care could look like. So I was sitting at the conference, I was sitting in the front this morning and listening to this. This is very new to me. I've had a number of people, there's some of them in the room. I know Eric's here and Greg's there. We've had conversations about open data and 201 participating. And I asked that question about being scared, and I wasn't trying to be, I'm not scared. I just imagine as we start talking about these things that might pop up. But I'm glad I asked it because I realized how little I know about this field. And actually to be able to come up and share, I appreciate Daniel's invitation because while I know what we're doing on a technology front, there is so much to be learned from the open data front. And what a great time as we're building out something that I think is pretty remarkable, to be able to sit in a room of people who really, we need to design it to make sure that we can maximize the horsepower out there in the community. And so I kind of changed my presentation around a little bit because there's a lot that I can go into in each of these areas, but I really thought to start with the why and to have that conversation with all you was the most important. You know, our county is far ahead and has their own open dashboard, right on the county site. What about a 2-on-1 dashboard? What about a statewide 2-on-1 dashboard? Where's Michael? Is Michael here? I don't see you. I think we were talking a little bit about it earlier. Is how do we do it? So I had this standard slide of challenges and roadmap. Does it look like any of your challenges? There's that word interoperability. I swear at the reception there's going to be a drinking game around how many times someone says that. But what it means to me, I've been in the 201 field now about 8 years. And I've sat on a national board for 201 and a statewide board. And I've seen the conversations happening in open data. And we want to advance the field. And I think there's this interesting time that we're in about how do we get there. And so as much as my goal really is to let you know what a wealth of data 201 has. And we may not be the best at marketing and packaging it, and I think that's just where we are in our movement. Some are stronger at being out there. Some have partners out there that are asking for data. Raise your hand if you've gotten 201 data before. Perfect. So I hope when you get your 201 data, the first thing you say is, could you do this, or would you do this? Because I think as we build a regional information exchange and as we develop the 201 model, you're asking of what you would like. It might just be one more question we ask a client on the phone. It may take 10 more seconds for us to ask that question. But imagine the wealth of information you might have that could be actionable. And when we think about 201 data now, we can track unmet needs and we can give you maps of service gap areas. But until we have full closed loop referrals to where we know what happens every time we tell someone to go somewhere, just that basic feedback loop, the data we think will be truly life-saving in a lot of ways, especially when we talk about natural disasters. So with that, I thought I'd just hold for some questions. Is the question, where's the bar? Daniel, do you have a question?
Well, I was going to ask you more about how you think about open data relative to 2-on-1 and more protected information.
Sure. So on the first part, before we get to the protected side, I think there's a lot of expertise, and sometimes when our field gets approached by open data, the conversation open data, I think we have a natural reaction. Maybe it's not natural, it's an instant reaction of, this is our data. whether it's resource data or client data. And I don't think it's in the sense that we don't want to share our data. I don't think it's about that. I think it's maybe what I said earlier, is not understanding how it can actually accelerate learning. I always think of the app stores, right? I think 2-on-1's like, there could be so many apps out there built on the 2-on-1 database if there was more understanding. And so I think that was one of the things that I shared, is having more of these discussions at a national 2-on-1 level to really get everyone on the same page and show some areas where it's worked. On the confidentiality side and the privacy and security side, we're challenged with that right now. Fortunately, San Diego Health Connect, who is already a federated health exchange, has dealt with consent and privacy and security. And we actually just brought on their CEO as one of our board members, and we're going to be sharing services, because why recreate it for the social service sector for us as nonprofits? We're going to be leveraging everything that San Diego Health Connect's doing in terms of privacy and security. Does that answer your question? I tried my best. Anyone else? Anyone want to know what to do with 29-year-olds? No, I'm just kidding. All right, well, thank you very much for your time, guys. Oh, okay. Do you have your why?
Yes, I have.
Okay, you can do your why too.
My why is I want people to lead happier, healthier lives.
Okay, that is ridiculous, because that's our why. I'm dead serious, word for word. That's what our team came up 4 years ago. Was that placed?
That gets me out of bed in the morning.
Awesome. Thank you.
I have a zillion questions, so I'll find you at the reception. But have you ever tried working with a community group, essentially crowdsourcing your information referral to sort of get feedback from community groups, from groups that are interacting with those agencies to improve your data? Have you ever tried that?
Yeah, so it's interesting. I hadn't seen Eric in a while, and we were talking because we had a think tank at one point in time. I will say that we need to resurrect it, and we need to do it. We've tried. We've had different groups in. We've had people from the economics department at the San Diego State, epidemiology at San Diego State as well, who have come in, and we've done a number of data projects, but I don't think in the landscape that we're talking about in this room. What was that?
I have a question.
Oh, I thought that was 1 minute.
No, I have a question. Oh, right, I'm the timekeeper.
Yes.
What's the biggest obstacle as you try to spread the word, as you try to generate interest, et cetera, et cetera? Is it financial? Is it privacy? Is it people's reluctance? What's the big hurdle that, if you could clear it, you'd see a more open road?
Are you talking locally in San Diego?
Sure.
Okay. Up till about a year ago, it was just getting everyone on the right page. 211, when you think of 211, people think of a helpline. So they instantly think, oh, it's a phone number you call. And so there would be a community convening where a group would be sitting there and saying, you know what, we're working on this special project with youth. We need to develop our own resource directory. And we would be sitting over there going, no, you don't. We have 6,000 programs and services. We can create you a subdirectory. So those were the conversations that were being had. And as time went on, bringing partners together, it's funny because we just opened a center about a month ago, and upstairs is the call center, and downstairs is what we call the connection center. And so basically what we did was we created hub space so that nonprofits can come in and work on projects together. So we have a hub that's dedicated to military and veteran programs. It's our own military veteran program with 4 other military transition nonprofits that are in the same space who are doing client-based referrals over the phone. And it's phenomenal to see these people who've been working in different offices just in the same space to see how some of those things are. So I think it's just time in getting more and more organizations to come in and realize we're not trying to own the service delivery process. We want their input, because what we do over the phone or through the web or through any kind of transaction we're doing is to support them. It's to make the nonprofit sector as effective as possible. We want to give them, we're already giving them reports on, here's the thousands of clients we sent to you last month in aggregate. Here's the age, the income, here's what their primary need was. More of those conversations, I think, need to happen, because I always think of 2-on-1 like a utility. It might be something very different to you than to you, but if we all know the potential of it, we can create it very differently in different areas. Is that okay? Got it? Other questions?
Can you hear me? Yeah.
You're on.
John, it's really exciting to hear two-on-one leadership talking about openness and interoperability and promoting access to your data. I have so many questions for you, but I'll try to pick one that's just specific to this particular event and the topic here, which is the Open Health and Human Services data portal and the data that's coming from the government in most cases. What role do you see government, which provides some services and funds other services, in promoting access to open, interoperable data about those services, data that you could use and others?
Well, speaking as a nonprofit guy, I think it's, I hate to say it like this because it's not a pun, but being open, right? I think a lot of this just takes a willingness to be okay with having conversations. I think the resistance would only come from people feeling that something awkward or uncomfortable could happen from someone playing in the same space, playing in the same sandbox. Was that specific enough? I mean, I hate to say it, but technology is not it. I think training, I think getting people trained to this is the way we need to do business in this century, getting case managers trained on new technology once it's available so that, we've got these great tools over here. We want to make sure that everyone has access to them.
Could government be publishing data about health and human services that you could consume and deliver?
Could government be publishing data for me to consume?
Sure, yeah. About the services it provides, the services that it funds?
I don't know the question because we do receive those services. Maybe I don't understand the question. Sorry.
Like state Medicaid agencies, the services that the government operates.
Well, we keep track of all those services. So we have access to that. You mean like in an open stream way?
Sure.
We're actually working on that project right now. 211 California, United Way of California, to create a data set across the state and across the country so that each 211 doesn't have to come up with their own database for statewide and national. Is that what you were referring to?
Yeah.
Okay, sorry about that. Well, I really do appreciate the time. It's nice to have this time with you. I hope it was helpful. Thank you very much.